Hey there, everybody. How's it going? Just want to check in and see how everybody's Thursday's doing. Hey, you know that we have chiropractic and physical therapy and massage therapy here at our location in Elkhorn, Essential Motion Spine and Sport. The reason for that is the combination of benefits that you get from doing those things combined. The reason that you would do, say, oh, you should go see a chiropractor, you should go see a physical therapist, you should go see a massage therapist. There's lots of reasons and opinions as to why someone would tell you to do that. Normally, they would tell you to do that if you had some kind of, you tell a friend, hey, I've got this neck or shoulder pain, or you tell a friend, hey, I've got this back pain. Oh, you should go see a chiropractor, you should go see a PT, you should go see your doctor, you should go see this person. But really the reason that you're looking for a suggestion or a referral is you want the problem that you have solved. You don't really care how it gets solved. You're just looking for the result. So, really the reason that we combine them is when you come see Jeff for chiropractic, you're going to get that instant, pain relief, that instant satisfaction of the joints moving, the mobility, that kind of like relaxation. I feel better. Okay. That is very important to get the joints moving and feel better quickly and get that release of the tension. Okay. Then what we would do is we'd come out here into the physical therapy area. And the reason for that is not just because, PT, what does that mean? It doesn't matter. What you need is once you get the relief and the instant relief and the satisfaction of the release of tension in the joints from the chiropractic side, then we want to come out here into the gym area for physical therapy to work on very specific exercises, not just general stuff, very specific exercises so that you know what to do when you get home. Because that pain more than likely is not fixed in one chiropractic visit. It will feel better, but you need some things, an action plan. You need some steps to take that. Okay, when I go home, I know what to do so that I can keep this pain away, or I can, at least if it starts to come back, I know how to minimize it. So we're going to start there. The first phase is just knowing what to do, how to move, and some very specific movements. We're not even really working on strengthening in the first right away when you have that. It's just to get the first phase, the pain relief, down. Then once we get, we progress through the phases, and now I'm feeling better. Then the physical therapy, we change into more of, kind of a remodeling of the tissue that's been injured, or a return to function type phase where we're going to work on some more like strengthening exercises. Of course, a body that feels strong and that feels healthy, that's more fit, is going to have a less likely chance of getting re-injured. So the biggest predictor of future back pain is having previous back pain, or same goes for neck, shoulder, whatever. So now that you've had it, the chance that you get it again is quite high unless we do something to reduce that chance. So, I don't know if I'm just going to walk in here to chiropractic here real quick as well, but there's other things that are involved in chiropractic as well besides just the adjustment and some of the soft tissue and manual things that Jeff does on the table. I'm going to just flip it around. You want to explain what we do for that's a picture. That's not the right one. I can't flip the camera around. I'll just go this way. All right. So there's also dry needling. I don't know if people know that we have this, but Jeff is certified in doing the dry needling techniques. Why would we do that? Why would someone want that or get benefit from that?
Let's see. Dry needling. There's different, just like any, modality or therapy, that we do. There's different benefits for it. Sometimes we do dry needling we call them trigger points. So you get like a knot in the muscle that can kind of radiate some pain. There's a trigger point like acupressure stuff you can do, but you can actually do some, insert a needle into that trigger point. You can get a little release out of that muscle. It has a little kind of muscle twitch or a spasm or release, kind of decrease tension, decrease pain. We do it a lot with acute cases where someone maybe we can't do. I do a lot of like active release and Graston as well. Even though you are sticking a needle in someone, it is less. It's not as not as invasive. It's invasive, but you're not compressing the tissue as much as say if I did some ART through like the forearm here. You take it, you pin it, you stretch it. Well, you got something acute, we can take a needle and kind of work some of those kind of like forearm flexors and kind of work up into the insertion point or even the muscle belly if that needs to be used as well. So.
Because the needle itself is so thin, the filament and it's so small, it's less aggressive than some of the soft tissue techniques that you do.
Yeah.
Is that understanding right? So I mean, and the purpose or the point of it is that instant or very quick, pain relief and relaxation and release of tension in those muscles and knots that come with having an injury in in the neck, in the back, in the shoulder. Mm-hmm. So those are some of the other things that.
Because people, when you do the needling, sometimes say you got a low back or trapped, and all of a sudden like, man, I felt that release. And, say we haven't done any adjustment, we haven't done much ART, Graston, or any other even like exercise or rehab. All we do is just the needling. They can stand up and be like, oh, that actually does. I can move a little better. I feel a little better. So. You can make some pretty good changes with just a little acupuncture needle. So.
Okay, and so that's just some of the extra, stuff or other things that can be done, in this room here in the chiropractic room is not just using the table for the manipulations and the chiropractic adjustments, which are very helpful and very beneficial, like we talked about. But there's other things that he can do with some of the soft tissue. In the muscles, in the joints that give you that release and that instant pain relief that you're after, that you're needing. And that's the thing. I mean, it hurts. You want it fixed. You want it gone. And then we just combine that with the other things that we do here as far as the exercises and movements in this area, in the physical therapy area, so you know what to do at home, and you build that strength up so that you're less likely to have it happen again later. And then we also have the massage. And that, again, is just that is more on that relaxation side. That's more on that side of like, man, I'm feeling better. Pain is reduced. Now I just need to relax. I want some soft tissue work done. And the combination of the three in some way, it doesn't have to be all three. It can be, A and B, A and C, B and C, whatever. But we'll get a plan fit to you specifically so that you know exactly what to do. You get the result that you're after, which is decreasing the pain, getting back the function that you want to do. I mean, you want to get rid of the pain, go back to work, go back to living, play with the kids, play your sports, do the stuff you want to do and not have to worry about. And really the fear too of I don't want to re-injure this. This is so not fun and so painful. I don't want to do this again. So we'll help you get past that, build a custom fitness program so that you know what to do and you feel like, okay, I now have the confidence to go back to all of my workouts and daily life and not worry that if I'm going to bend over and pick something up, that I'm going to do this again, or that, if I sleep wrong, now all of a sudden I won't be able to turn. So, all right, I just want to share with you, the services that we provide and the reason behind why we do that. Okay? All right, thanks a lot.